Stretch marks can happen due to any cause in girls and boys. Abdomen is the most common area, but it can happen on arms, thighs, buttocks. The young the stretch marks or the fresh the stretch marks is more so reddish, and the older the stretch marks is more so whitish. So the main thing is you have to understand your stretch marks and your treatment options. Stretch marks. Come, let's discuss about stretch marks today. Stretch marks can happen due to any cause in girls and boys. So it's not only because of pregnancy, but there are other causes like sudden weight fluctuation, either weight gain or weight loss can cause stretch marks. And also another thing with stretch marks is it can happen any part of your body, wherever the skin changes happen. That is, abdomen is the most common area, but it can happen on arms, thighs, buttocks. So these are the common areas where stretch marks can affect. There are two kinds of stretch marks, that is either rubra or alba, that is red stretch marks or whitish. The young the stretch marks or the fresh the stretch marks is more so reddish, and the older the stretch marks is more so whitish. So red stretch marks, always the treatment gives you better results, whereas white or the older stretch marks, the treatment options is just about fading it out. So it's always better to reach out for treatment options as early the stretch marks as possible. So coming to the stretch marks, prevention is always better than cure. So this holds very best for stretch marks, because once you prevent stretch marks, that's the best way you can take care of it than treating it. Prevention meaning by keeping your skin very well hydrated, not only during your weight fluctuation but throughout your lifetime. It's always better to keep yourself well hydrated for your skin health, and also always make sure whenever there are hormonal changes or weight fluctuations, commonly using the moisturizers or any emollients which will supple your skin and there is no dryness of skin, because whenever there is sudden damage to the skin, this stretching happens, and if your skin is not well adaptive to that change, that damage will turn into stretch mark. So that stretch marks, if it's reddish, it's always better to reach out and start your treatment options as soon as possible. Now coming to the treatment options as such, as I told you, pregnancy being the most commonest stretch marks, or for that matter any fresh stretch marks, it's always better to start your treatment early. If it is in pregnancy or post-pregnancy, post-childbirth, you can start your treatment as early as 6 weeks, that is 1.5 months after delivery, because the results is going to be good. So depending on your stretch marks, on the area and on the age of your stretch mark, treatment options can be decided. So what are the treatment options available? So we do have microneedling, and we do have regenerative therapies, and we do have laser therapies. So microneedling and PRP is more of a regenerative therapy. More so we usually do combine these two things. Regenerative therapies being PRP, exosomes, MCT, that is photomodulated PRPs, are one of the advanced treatment options available. So these comes in sessions, that is monthly one session. Depending on your damage, you can go up to 5 to 6 sessions of treatment depending on your results per session. So microneedling and PRP is nothing but autologous blood. That means patient's own blood is withdrawn. It has been machined or centrifuged, and in MCT we have another step of photomodulating those PRPs and creating an exosomes, and then injecting into the affected stretch marks, affected area, and then also combining with microneedling will give you much better or much quicker results. So this is around 30 minutes to 40 minutes depending on your area of how much spread out the stretch marks is. And coming to the laser therapies again is a session wise therapies, which again is done monthly once, that is around 4 to 6 weeks once, and it goes on for 5 to 6 sessions depending on your age of the stretch marks. So laser therapy, before going into lasers, we do apply a numbing cream on your abdomen or hand or thighs, wherever the concerned area is. Numbing cream is nothing but a cream applied to the affected area, which helps in numbing that part, or it gives you a little bit of mild anesthetized thing, so that your pain sensation reduces. So once 20 to 30 minutes of application of that particular cream, we go ahead with lasers. The laser what we use here is CO2 lasers. So that helps in fading out your stretch marks. And there is another laser what we use, that is Q-switched laser, which helps if it is a pigmented stretch marks. So it helps in reducing the pigmentation and definitely improving the skin texture. So these are the treatment options available. So as I rightly mentioned priorly, that prevention is always better than cure. Be it be pregnancy, when your skin is going to be stretched, always start your skin hydration or applying emollients or moisturizers, aloe vera based cream to your pregnancy belly or hands and arms whenever your skin starts setting. That is as early as 3rd to 4th month of your pregnancy. So the main thing is you have to understand your stretch marks and your treatment options. So you will be confident enough to wear whatever dresses you want to.